Hello, I'm Dr. Brad Holmberg. I'm founder of InvisalignDoctors.com. Do you use the 3D controls to develop dental arches for your Invisalign cases, or do you usually accept what is sent to you by the technician? Most arches developed by Align look good from a visual perspective, but there may be unnecessary or hidden movements that can dramatically affect the outcome and extend treatment time. I always set the arches before working with anterior teeth. I'm going to demonstrate on a few cases how I use the 3D controls to develop the dental arches. Well, let's take a look at this case. This is a female patient. She's 30 years old and she wants her teeth aligned. So let's go back. This is where she's at to begin with, and this is where she's at there. She probably doesn't like the fact that her central incisors sticking out here. She's not saying that she wants her arches developed. She's not coming in and saying, but she probably does realize that she has a dominant cuspid to cuspid smile in the upper because she has omega form and the premolar teeth are tip lingual, are tip lingual, and they really don't show much. So she wants Invisalign. So here's the treatment plan. I always look at the arches first and I say, is this okay? What's okay and what's not okay? What's not okay is the omega form, so we have to expand out. But the molar teeth aren't bad. They're performing a lot of movements. I'm not even concerned about the rotation of the molar teeth. Again, she's 30 years old. You could rotate the molars, but the more you move posterior teeth, the greater the treatment time, and you're increasing the complexity of the case a little bit. So if the patient just says, I don't like this, I'm going to just leave the molar teeth where they're at. But how do you do that? Are you going to tell the technician to just clean this thing up, get rid of the movements? No, you're going to have to use the 3D controls. So I'm going to just specifically just develop the arches in this case. Let's go ahead. So the 3D controls are on. And I'm going to do this on all of the posterior teeth. By the way, look at there's blue level movements over here that are unnecessary for sure. There are unnecessary and I might say hidden movements in this treatment plan as far as posterior teeth go. So I'm going to do this with every tooth. I'll show you what I'm going to do. I'm going to say make unmovable. I'll do it to the second molars. Then I'm going to do the first molars. And I'm going to do it then I'm going to go back and I'm going to say make movable. And you can see that the molar teeth are at the original position. I'm going to pause the video in interest of saving a little time, video time, and I'm going to go ahead and do that. I'll be right back. Okay, I did those movements, and now you can see there's no program movements. You see the blue dot, that's from the movement that was programmed before, but there's no movements of the posterior teeth. And I mentioned just before I started clicking these teeth that I mentioned that I want to leave the second molar or the first molars even in their original position. That's just a decision I'm making as the provider. If you wanted to add rotation, you could. But if you do, just use the 3D controls to do it. So the first thing I want to do is I want to correct a few of the rotations. I want to derotate, especially the premolar teeth that are not the molar teeth, but the premolar teeth. And then I'm going to use the most predictable widget here. This is called crown tip. This is a movement where you can expand without repositioning the root apex. Keep in mind that when you're moving posterior teeth and you're trying to move crowns and the root apices, that the crowns move much easier than the root apices. So if you try to translate a tooth and move it the root apex and the crown out 2 or 3 millimeters of expansion, you're going to procline that tooth. The crown may go out 3 millimeters, but the root apex will lag behind. So this arch form looks good. I just verify that I like it. If you decided that you wanted to bring this out a little more, just go a little bit more. And then you have to go down on the bottom and you have to coordinate the arches. So I'll just do quickly the derotation. Again, you don't really have to. There's a little bit there. I'm just doing it kind of quickly. But you cannot leave this kind of an interocclusal relationship. So we're going to go like this. And when I bring it out, I'm going to have to go a little bit of extrusion too. And I can even then add a little bit of translation. But there's 3 millimeters, but keep in mind that most of that movement is the crown tip movement. That looks pretty good there. Here. By the way, you're getting when you expand out there, you're getting a little retraction of the anterior teeth. Sometimes that's desirable because sometimes you're battling heavy anterior contacts. But you can see how these anterior teeth moved as I adjusted the arches. That's why I always set the arches first. So now we have a few heavier contacts. You can just hit auto resolve. It's just going to tweak those a little bit. You can go back in here and you can say I want a green mark, so you can add just a little bit of extrusion. In cases where there's programmed anterior intrusion, it's perfectly okay to add some posterior extrusion, but try to keep it under blue levels. That means you try to keep it, like if you go too much, if you go over 0.5, it becomes a blue level movement. You can see that the occlusion on the molar teeth, you're not seeing the green marks, but that's the original. So obviously she's got occlusal contacts. So now the arches are set. So there were 30 aligners in this case. Now I can see really where I'm at with overjet, and I can start working on the anterior. By the way, I really like the position of these, so I'm going to now lock these in so that when I move the anterior teeth, it doesn't start, you don't get these compensatory movements of posterior teeth. I got the arches all set. So now you hit lock. Now there's still program movements, you see, but they're not going to move beyond here. So when I work in the anterior, these teeth aren't going to move. The next step is to run live update. You want to run live update so that the 3D controls work on what the arches is processed, and then you move to the front. So let's see what happens when I simplify the movements of those posterior teeth and run live update. I'll be back after it's done running. And by the way, I'm just going to click this button right here. Okay, so live update was running. It was 30 aligners. Now it's 14, and it's really, really good. Notice the movements now. There's a little rotation. There's a little bit of crown tip, which is really predictable for the expansion. The arches look great. Didn't move the second molars. Again, if you wanted to derotate the second molars there, you could make that decision to do that. And I haven't even started working in the front, and we're down to 14 aligners. So the treatment time basically went in half because those posterior movements, especially the ones that are repositioning and torquing those roots, take a lot of time. They don't allow much movement per stage because they're complicated movements. So what would you rather do? Would you rather just accept the arches of your cases, or would you rather customize yourself and use the 3D controls? Well, I vote for using the 3D controls. This is the first, I'm going to start a series on developing the arches because I think repetition's good. So if you're getting these online or you're on InvisalignDoctors.com, they'll be posted on that site in the membership section. So I'm going to do another one. It'll probably be released in another week or so, part two, and I'll just show you a whole nother case. And we'll just go through this a few times so the repetition helps. And by the way, what I did in this case is I had already set up this case. Here's treatment plan number 3 right here. But I wanted to go, this one's already set. I wanted to go back to treatment plan 2 that had 30, and I wanted to set it up again and practice on it, you see. So I hit modify plan 2, and it took me to a whole nother series or a whole new treatment plan that I can use the 3D controls, even though treatment plan 3 has been done. See that? It's the same thing. That's it for this video. I hope it's helpful. I encourage you to check out the site InvisalignDoctors.com. That's it.